Okay, hello everyone. So this is the second part. We talk about the main organ, which is the prostate, and anything else that is related with the prostate. Now, another thing that when prostate get enlarged and push it up into the bladder. By pushing up into the bladder it diminish its capacity of holding urine. Also, the prostate inflammation, it can inflame the bladder, and the bladder when get the bladder wall will get inflamed. It shrinks, it diminishes its capacity of holding urine. Therefore, the men just go often to pee. So because instead of having about 600 milliliters, it can decrease to 200 milliliters, the capacity of the bladder holding the urine. So when you go in the nighttime frequent 2 or 3 or 4 times, it means that it's a problem with the prostate being enlarged. But also the bladder can shrink without having necessary problem with the prostate. It's very well known, it's very popular, but when you have prostate problem where you go frequent urination, but not always that. That also it can have a urinary tract, not infection, inflammation I would call. So it comes from the tendons, abdominal tendon on the pubis. That's people that does a lot of workout, a lot of excessive abdominal work to do the 6 or 8 packs over there. They pull those tendons, they get inflamed, they get injured, the inflammation travel to the bladder, so that develop urinary inflammation. It's urinary tract inflammation, so the bladder inflammation, cystitis. Also sometimes that inflammation from there go down and inflame the prostate also. That could be also another way to look at this one. So again, that will be a signal when you go in the bathroom a few times during the night to urinate. That mean there is most of the time there is some prostate problem, but not all the time. Of course, it's good to have it checked very well and very quickly. Now, of course, you can have a prostate problem, and you still can enjoy having intercourse, and actually, it's even helpful, right? Because it get the prostate to move, it gets some exercise of the prostate. Now, it's not necessary that you have prostate problem that is over. Of course, there's sometimes the prostate is really very inflamed and cause pain and cause discomfort, then the appetite of having sexual intercourse, having sexual relation, it decreased tremendously. But sometimes even the prostate problem, it causes some mental issue. In other words, getting unhappy, getting upset, getting scared, getting afraid that's what's going to happen. That one, of course, it decreases the desire of having sexual activity. I don't think it should really should think so deep into that prostate problem that's it, you really finish with the sexual activity. Even if you have a prostate treatment, even if you have a prostate surgery, you still can have intercourse, because the prostate is just is not necessarily the organs, the sexual organs. No, it has some role in the sexual activity, no doubt, some hormonal things, but its role is different. Its role is just to push through the urethra, whatever go through. So that is that some people has a problem of having erection and not being able to have intercourse, to enjoy a sexual activity. But that's not necessarily come from the prostate. That comes from mental things. There are some people who are very sensitive mentally. They get afraid, or because they don't perform proper. They get scared. They don't perform proper. They are imbalanced. It's all the kind of things go throughout their head. Of course, then really it diminish the desire. It kills the desire of having erection. Without you want it, without being this your intention. So I suggest everybody, and the ladies know this one, and they are very, very wonderful all the time, because it's hard to be a man when you have to perform sexual activity, because the woman has organ there and is there, but the man has to really perform this erection, which is very complicated things. The muscle has to be contracted. It's a very complicated thing. So it's harder for the man to really get to the point to perform than for the lady. Of course, it's important for the lady also. It has to have a special mental stage in order to do this, and is conditioned by different mental decision, right? But the man is also anatomical things. It's a mental, for both for woman and man, is a mental things. But for the man, besides the mental, is also anatomical, because that has to be erection. That muscle has to be contracted in certain ways. Sometimes just in the middle stops, not because it's not really power into the muscles, but because the mind is the one that really control with the man. The mind is the one that control the quality of the erection. So it has to be confident, and whatever happen. If it happen. If it doesn't happen, it's wonderful. But if it doesn't happen now, it's going to happen tomorrow. So always the ladies are very, very, they understand and are very careful with this one, and they will understand that that has nothing to do of being a man. This has to do of the anatomy and of the psychological attitude for that moment. The things is that the man, in order to perform, that really should never be worried, never be afraid, never be concerned of what the woman think, because we don't do this to win the gold medal. We do this for both to have a equal pleasure, equal enjoyment, and it is both try the best. In fact, actually, the sexual relation is an act that comes behind mental decision. This mental decision, which is taken by I would say by mental comfort. So you like the man, or the man like the lady, and then once the attraction go deep into the mind, then really come up that decision. Is not something that have obligation or have a duty. I talk about the men. Well, it should not be for the ladies. Same. So this why it's just a result of want and have a special attraction, special respect, and special attitude one for each other. So I think that is in regards having the proper erection. I think I covered most of the things. Mukesh, do you have any other question? Is anything I missed?
Just one more thing.
Okay.
Many men have consulted doctors, and because of the inflammation or enlargement of their prostate, which I think in science they call it BPH.
Right.
Right? What does BPH again stand for?
It doesn't matter. That's anybody can look in the computer and find that one. So not waste his time with.
So they're given medication.
Okay.
And they have side effects. So that is one of their concerns, and the side effects are not. It affects them, also sleeping wise, and they just feel something different. So how can we help men take care of their prostate? Like maybe is it their diet? Is it what can you recommend?
Yeah. Okay, there is a number of things. Now, up to now, I was telling here exactly what causes. Right. So if you know what causes, you by yourself, you try to help try to eliminate the causes and try to fight against those causes, which are exactly what I just talked about in the first part. Now, and this way you can prevent, because the best thing is to prevent, right? You don't have to have a prostate problem. You just try to be relaxed and don't let yourself to get stressed. Second, to not to have prostate problem. You try to treat if you have any low back problem, or if you have any coccyx problem, or coccygean problem, if you have any sacroiliac problem or sacral problem. You try to treat all those problems. So this way, 100%. If you have hemorrhoids, also treat all the problems so you can prevent the prostate to get inflamed, to get enlarged. Of course, any medicine in the world, they have a side effect. It's not possible. This is not a mistake of the doctors. So that's the way they are created, because you want to do something else that the body is designed to do. Now here you can take less, but there is some other things you can do. Now, hot baths. You just get some pot and put the hot water, and you sit with your butt in the hot water. This relaxes the prostate, because the prostate gets enlarged for the fact that it's very tense and the blood doesn't go very well through. So it's a reaction of antibodies. Okay, so that's sit in hot water. Yes, you can do daily, or just get the hand shower, put over there on the anus, on the body, and hold it there for 1 or 2 or 3 minutes, whatever. Hot. So this way, not too hot to get burned, but hot in order to relax the sphincter and to relax that region, and put the hot water also to relax the sacrum over there in the lower back. Another thing is there is some prostate exercise, and also that what help the prostate to create the contraction. So simple as tie the anus, relax, tie the anus, relax, tie the anus, relax. So you can then divide this in three sets. You do 10, 3 sets of 10 with a pause in between of 5 or 10 seconds. So you increase. You keep the first set of squeezes 10, second you increase to 15, third you increase to 20, and increase. That is strengthen the prostate, just work out those muscles. So the muscle of the prostate, because the prostate is the whole thing, is a muscle, and all the sphincter and the whole region, the muscle getting contracted and relax. They develop, like you go to gym to build up the muscle. You lift weights, repeating just 10, 12 repetition, 3, 4, 5 sets. The same thing with the prostate, because it's a muscle. So this way you develop strength of the prostate. Second, you do stretches exercise. Stretch the lower back region, because that is the cause of the prostate problem. So then you just try to treat those things. The exercise is the most handy that you can do, stretching the lower back and doing hot baths with the prostate and doing those exercise. So this is something which you can avoid taking the drugs, or you can diminish the drugs quantity and see how is it. So it's but you cannot say that the drugs, the medicine take the medicine who has no side effect. There is no such things. And also there is all the things that take saw palmetto, or take pumpkin seeds, take zincs. Well, yes, they help, but very, very little. Almost you don't see any changes, because see what happened? The causes remain there. What causes the prostate problem is there. So what I was telling you, just not at the appearance, not at the end, just to take care of the symptoms. Symptom is remove the inflammation, which is good. It's not bad, but it's not enough. The prostate problem keep going on. Now also taking vitamin, zinc, taking the sopalmet, all those things yes, they are good theoretically. Practically, it doesn't do much help based on my experience, because the cause stays there. So treat the causes. I think I kind of cover a lot of things. There is anything else, Mukesh, that you want me to?
I think that's about it, Doctor. Yeah. And thank you for the insightful explanation of the concerns of prostate and how to maintain and how to keep young.
But everybody should know one thing. Sorry to interrupt. Yeah. Should know one thing, that yes, most of the men, they develop prostate problems, over 95. Okay, doesn't mean that you have to. That can be easily prevented if you take an account whatever causes the thing that I just enumerate here. So I don't think we have to be discouraged only because you are a man. You have to really do prostate problem, like poor ladies, they develop nodule in the breast, a cancer in the breast, they have to remove the breast only. No, it don't have to be dramatic like that. You can live 80, 90 and you still enjoy having healthy prostate if you know all those causes, if you take an account to stop those causes to really affect the prostate, because the prostate itself cannot get sick. It has to be affected by some collateral things, something from outside. So I just mentioned most of the things, but if I was not complete, anybody can write here so I can add more things. You know, it was a very spontaneous this video, because just Mukesh this morning asked me about that. I said, well, let's do it since you are here, so let's do this. So I really didn't prepare it in the details, but at least 90% I enumerate here. At least 90% of the thing that I was supposed to say, I did already in this video. Okay, Mukesh?
Okay,
Am I
Dr.
right?
Christian. Yes,
Yeah?
definitely.
Okay. So next time we're going to talk about another subject.
Yes.
Okay, everybody, you take care, you stay healthy, and take care of all the men take care of your prostate, because it's good not only for you, but it's good for your partner also. They can enjoy having you healthy and enjoying having nice relation. All the best, and talk to you next time. Bye-bye.
Bye-bye.